Welcome everybody to the March 7th board meeting, and I want to thank all of the board members and of course our Windsor Essex community for supporting Hats On for Healthcare. It's a great event, and the way it started was just an idea to say, hey, how can we do something simple that can engage the community and get individuals involved. And it's taken off and has raised substantial sums of monies over the years. So thank you to the foundation for running the event, and it does some great work. And I know the kickoff was this past weekend, and it was a great kickoff. So thank you, the community, for supporting healthcare in Windsor, Essex. So just hopefully I'm getting near the end of providing updates to influenza across Canada and how it impacts across Windsor, Essex. So you'll once again see we have the solid blue line is the current year impact. This dates back a couple of weeks into the middle of February, and the dotted line is the average for basically the last 10 years. And again, we talked about this, the season started a little bit earlier than the average, but it peaked out before the average. So it wasn't as bad as the average over the last 10 years. But as you can see, similar to the average, it drops and then kind of steadies and goes into a plateau until it eventually dissipates and drops off dramatically. So we're still in the influenza season. By this, the peak is over. We're on a descending scale, but it's plateauing. So just what you're going to see from the hospital data, as well as from your own experiences with people in and around you, is pretty much everyone in my household has caught influenza. Me, maybe not so much, but others for sure. And it's still in the environment around us and is still there with us. And hopefully as the season starts to warm up, and it's warmed up a little bit prematurely as compared to previous years, people can get outside and not be stuck indoors. And that might help with respect to reducing influenza. So what we look at here in Windsor, clearly influenza A is our wastewater data, and consistent with what's going across Canada is what we're seeing is a drop off with respect to influenza A in our wastewater. So that's a good thing. So early March, it's dropped off, and hopefully it stays where it's at, and we start seeing the numbers start going down. Same for influenza B. We've talked about this before, is influenza B is if the influenza season is to last longer, it's because of influenza B. So hopefully those numbers, it did have an increase, dropped off, went back up again, and now has dropped off. Hopefully it stays down there and we don't have a longer influenza season because B doesn't extend it. With respect to COVID, similar is we saw the increase over the December months, early December, late November, and then it's dropped off. And sure enough, with respect to wastewater, it's dropped off and or steadied or plateaued. And we'll see that with respect to the data. RSV was earlier in the season. We talked about this with our pediatric population primarily in late October, early November, and it has dropped off rather dramatically. A little bit of increase in the month of February, but into March, things are looking good with respect to RSV. So if you look at the data as it relates to our inpatients and our daily averages, the blue line is COVID. It's dropped off since our last meeting. So for the month of February, we've been averaging approximately 14 inpatients a day in the hospital. And previous month, when I announced this, it was around 25. And of course, it hit a high of 30 on a given day. So we're about half of that. So that's very positive. Flu, like I stated, that we're seeing across Canada and even in the Windsor influenza wastewater, is it's kind of stabilized and plateaued. So we're seeing about the same amount of numbers, and that's inclusive RSV. It's dropped off a bit. So since we had those numbers, it's gone down, and hopefully it'll continue to go down. So hopefully we're at the end of all of these seasons, or nearing the end, is we're getting closer to the end than we are at the beginning for sure. So that's some positive data. We're still at the hospital. We still have the masking requirements that we put into place in December. I can tell you all of the hospitals are actively looking at this, and we are hopeful we can make some changes where we can reduce the masking requirements in the month of March. So stay tuned. But for now, the masking requirements stay in place until we see the decrease be more consistent and we don't have an upturn with respect to these issues. One of the big announcements this past month, and that is in effect and taking place right now, is on every given day we receive funding. It started March the 1st. It was running before Friday, Saturday, and Sunday evenings from 3 p.m. to 11 p.m. at the Met campus. It's our pediatric diversion program, and now it's running 7 days a week as of March the 1st. So between the hours of 3 p.m. to 11 p.m., when a pediatric patient presents to the emergency department at the Met campus and a determination is made that they do not need emergent care, there is a team that will divert that patient to see a pediatrician and can be seen. And we've noticed that their overall wait time and their time to being seen has dropped dramatically as compared to previous pediatric patients in the emergency department proper. So again, we've received quite a considerable amount of funding, some $2.6 million for this program from the Ontario government. We, as stated, did a pilot in September, and we did the pilot all the way till March, and got, with this extra funding, we can do it 7 days a week. And we're seeing some great results and some great positive results. And even up until February of this year, from September to February, just over those 3 days, we saw over 400 pediatric patients were diverted from the emergency department for those 3 nights. So we stand to see a substantial amount of pediatric patients. And again, the hours our team picked is the hours that, unfortunately, there are limited services for pediatric patients in the community. So what happens is children, they're at school, they come home from school, even, having dinner, parents are coming home from work or at home and noticing the child is not doing well. It's getting, to 4, 5, 6 p.m. at night. The options are very limited for the parents and the pediatric patient. This gives them hopefully an opportunity, if they do need to be seen that evening, to come to the emergency department and be seen. Clearly, if they need an emergency, you come to the emergency department, but they can be seen and hopefully seen quickly. And that way, the parent doesn't have to worry that there's no options available in the community. So again, it runs from 3 p.m. to 11 p.m., 7 days a week now, including holidays. And it runs out of the Met Emergency Department for pediatric patients. So pretty exciting there. Next thing, I got some great news, is a project we have been waiting for over a decade. And it involves the construction of a 4th, what we call a linear accelerator. What everyone generally understands it to be is a radiation machine. We got approval or discussion, I can tell you, has been going on for over a decade with respect to the need for a fourth radiation machine in the Windsor Regional Cancer Center. We have three currently. And because of the demands and the needs, a fourth was talked about and was talked about and was talked about. And it wasn't until recently that the current government said, okay, we're done talking, we're moving ahead, we're giving you the funding to get that fourth linear accelerator, LINAC machine up and running. So starting this Monday, after an RFP process, we're starting construction Monday, March the 11th, at the Met campus at the Windsor Regional Cancer Center. And as stated in the press release, which is going out right now, is we perform approximately 30,000 radiation procedures annually. So the goal is we got to get this fourth LINAC up and running, linear accelerator, because we got to start replacing the underlying three. And we don't want to go below three at any given time. So once we get the fourth up and running, which should be later this fall, our goal then is to start replacing one by one the underlying three. So over the next, it's going to take about a year to replace each one, give or take. So during the next 36 months after this fall, after we get the fourth one up, we'll have three running, four running, three running, four running, three running, four running until we get all the three replaced underneath. And that way we can have four running in total. And that was why it was so critical. So again, this was promised over a decade ago, easily. A decade is, I didn't want to say 2 decades, but it's closing in on that. Definitely over a decade, and was not acted upon until this government, the Ford government, said, no, we're moving ahead and we're starting the RFP process and construction. So thank you to the Ford government for making this happen. And at the same time, you're going to probably be hearing some news about the cath lab and the second cath table, which has been going on for even longer than this one. And finally, similar to this one, the Ford government said, no, it's proceed. Some might say, well, why are you doing this? Why don't you just wait for the new hospital? We need this now. We needed this a decade ago to get this up and running. So there's patients that need this service now. And you'll see from the next photo where it's going to be located. This is if you're standing on Kildare Road and you're facing east and you're looking at the cancer center at the facade of the building at the south end of the Met campus. This is where it's going to be at the bottom portion there. You can see where it's going to be located. So it's in effect, it's being built off site right now as we speak. It's going to be installed and attached to the building because we don't have physical space within the building to put a fourth bunker. So this is going to be in effect a modular unit attached to the building, and access to it will of course be from the building. So from a patient's lens, it'll look as if they're coming to the radiation machine inside. So again, I really want to thank the Windsor Essex community for continuing to advocate for the need for this, our Cancer Center Foundation for their support with respect to this, our own hospital board, and also clearly the Ford government for making this happen. You have no idea how many meetings I've had over the years regarding this, regarding the cath lab, regarding the new hospital project, and all three are going to happen, and all three are going to happen pretty quick. And we're going to go bang, bang, bang. And before we know it, we're going to have those shovels in the ground even for the new hospital, which is going to be an amazing project for the benefit of our community. So some really great news that we're very pleased to announce today. Again, Monday, construction starts. You'll see some hoarding going up on the outside of the Kildare side of the Met campus. Don't be panicked. This is a good thing. And again, it's the fourth linear accelerator showing up. So I'm going to pass it over to Karen Riddell to talk about an update on the criminal cyber attack.
Thanks, David, and good evening, everyone. So as we had announced at the last board meeting in February, it's hard to believe February is over already, assuming that our CVIS and Pixis were up and running, we were going to lift the code gray, which in fact, both systems were up and running as predicted, and we lifted the code gray February the 6th. So all of our major clinical systems are now online and they've all been functioning properly. We still have many smaller clinical and non-clinical systems being added daily as soon as they're in compliance with the security features. So we should have another seven systems up and running, 7 or 8 systems up and running this March. And then we have a large number of systems teed up to go later, starting this month and into April and May. So those systems primarily are our HR, finance, type systems. So not so much the clinical systems anymore. Those should all be fully integrated, hopefully by the end of this month. So that's very good news as well. And everything seems to be working well. So great job to all the teams, and thanks to the public for your patience while the hospital's been working through these challenges over the last number of months. And that's all for me, David.
Yeah, thanks, Karen. And unfortunately, we've been paying very close attention to various cyber attacks happening across North America. If you need to just focus on that and some of the healthcare systems that are being taken down by these cyber attackers, it's just horrible what's taking place. But as Karen stated, these are criminals doing this, and can't be prouder of the team and how they responded immediately to this. And of course, how they've responded since then and getting the systems back up and running in a safe manner, in an efficient manner, and getting all the major clinical systems back up and being able to lift the code gray. So from a patient's experience, and starting in February, things were back to normal. Again, we just have these, there's a lot of systems, and it does take time to make sure that when we bring them up, they can fit within our new security system that's in place to ensure they're compliant. And that takes some time, even from these companies' lens, to have to upgrade their own system to make sure they can comply now with the system we've put into place. So again, as Karen stated, great work to everyone in this regard. So, Madam Chair, that's my report.